Good morning and welcome to Inside Texas Politics this Sunday morning. Coming up today, will there be a Kennedy effect on the health care debate? We'll ask our guest today, Denton and Tarrant County Republican Congressional Representative Michael Burgess. In this morning's rant, social conservatives on the State Board of Education have taken their hits lately. William Lutz of the Lone Star Report says that is enough in today's rant. Plus, in our reporter roundtable, Democrat Tom Schiefer gets company running for the nomination for governor. Our guest today, Dr. Michael Burgess, representing the 26th Congressional District and joining the questioning Romer Jeffers, writing politics for the Dallas Morning News. Dr. Burgess, thanks for joining us. Always good to have you on.
Great to be back.
Some Democrats and supporters of health insurance reform with that government option are now saying the battle cry is let's win one for Teddy. How much might this blunt Republican opposition as you go back into this debate when Congress picks up September 8th?
Well, I don't think that will actually blunt Republican opposition, but you certainly may see, and you've seen it in the past when other notable figures have left us. There can be an accelerant type phenomenon on an issue. Whether that materializes, I don't know. But certainly Senator Kennedy devoted his life to the issue of health care and health policy. That's one of the reasons I ran for Congress. So although we were on different sides of the issue, you got to respect a man who devoted his life to that, and I think we all do.
We certainly expect some tougher resolve, say, on some of the Democrats to try and follow through and go for that public option now, I would think some of those who are really pushing that will try and, raise this as a battle cry.
But it depends on how much that's been tempered by what people have heard in their districts these last 3 or 4 weeks. And it has been a pretty intense August, more intense than most members of Congress are generally used to. Mm-hmm. And I think it will depend on what their vote count looks like when they all get back and when the Democrats get back in caucus next week.
It has been an intense August, Doctor, and one of the things at these town hall meetings, there's been some facts, but a lot of myth. For instance, the death panels in the Democratic bill. Are there really death panels in the bill? I mean, will we have these end-of-life conferences that everyone's so concerned about?
Well, the bill itself, and it is a little bit obscure. The term death panel itself is not used, but devoting 10 pages to what could have been a simple sentence, a simple declarative sentence in the bill about let's pay the doctor for providing educational information about advanced directives, and then that turns into 10 pages of discussion with all kinds of limits and contingencies and requirements. You look at the very next section of the bill where the doctor's performance is going to be judged on how many people actually sign up for these. And then you look at the comparative effectiveness boards that we set up in the stimulus bill, and you look at the medical records, the great giant server that's going to have everyone's information on it that we set up in the stimulus bill, and you understand why people get nervous. And they get nervous about handing over more and more of control over their lives to the government. Put that in the context of we've taken over General Motors, we took over your financial institutions, and now we're going to take over your health care. People are nervous. That's what I heard during my town hall.
About here are discussions between a doctor and a patient about a prognosis that may not be good, and look at your options, and the doctor getting paid for it. We're not thinking about people sitting back and talking about, we're not going to pay and you're going to die soon.
But the parameters they put around that, why include that every 5-year interval? That was a red flag to people. And, quite honestly, we, Congress, could have ended that discussion very quickly. We chose not to. Now you hear on the Senate side, at least, they say, well, we're going to take all of that out of our bill because it's just not a fight worth having over this. I actually agree with them. Let's come back and tackle that as a separate issue. Why let the bigger argument be deflected by this one? But it wasn't handled well from the beginning. And again, I certainly understand why people are upset. I understand why people are concerned.
What about the strategy, the Republican strategy to beat the Democratic bill? Where is the Republican plan, the Republican bill? Why haven't we seen it?
Well, you may be being too generous when you talk about in terms of Republican strategy. Remember, the defeat of this bill right now is being entirely orchestrated and driven by Democrats. There are not enough of us. We are not organized enough. We certainly don't have the type of financial backing.
Opposition? They label you as the party of no. Where's an alternative?
Well, there are a number of Republican alternatives out there. Tom Price with the Republican Study Committee has a bill. Paul Ryan in Wisconsin has essentially what was the McCain plan from last fall that he's reintroduced. There are other bills. John Shadegg has introduced one. There is a larger bill that we have not introduced. Quite honestly, it has been difficult to get the attention of the Congressional Budget Office to get a score on our bill. Well, none of us want to introduce that bill without seeing what cost and coverage numbers are. We would like to have that information before we take that out to the public. So there are a variety of reasons why you're not seeing a Republican plan, but on the other hand, there are various Republican plans out there, and I don't think there's any great question. What would I like to see in a bill? Well, of course, we're missing liability reform in this bill. That's a big problem for me. I'd like to see some fairness in the tax code so we don't punish the individual, give them the same breaks as we give someone working for a corporation. The concept of buying across state lines, give the little guy the same breaks that you give the big ERISA protected companies. These are pretty simple concepts, but the number one thing that we should have done before we went home and we didn't do, you look at the number of the uninsured, there's 8 to 10 million people who have pre-existing conditions or are losing their insurance through rescissions. We could fix that through regulatory reform. Why we haven't taken that on as a separate issue and just get it done as a deliverable for the American people, I can't tell you.
Doctor, the political season is upon us. The governor's race is raging here in Texas. You support Senator K. Billy
Yes,
Hutchison, right? But your district, Denton and Tarrant County, battleground, right? Up in the air for Perry or Hutchison.
Well, there is the part of my district has a very strong Republican contingent, a very strong Republican base. I've not done any polling on this, and I think it remains to be seen. But both Senator Hutchison and Governor Perry are likely to work very, very hard in my district, and I welcome that. I think we will benefit from having the attention here.
Okay, you spend a lot of time in Washington. He's saying the issue is about Texas versus Washington. As a congressional Republican, what do you think of that? Are you offended by that?
Well, there are months that I find frankly frightening, and I think the governor is correct to draw attention to that. At the same time, we are each Americans and we are Texans, and please don't make us choose between flags because I respect them both.
The special election to fill K. Billy Hutchison's seat, are you interested in that at all?
Let me dispel that one right now. There is absolutely no way. I will unequivocally not run for the Senate in the special election.
All right, we always have to ask that question because you never know what people may have on their mind.
Well, unless anyone other than you asks.
Okay. Does it make you nervous, though, with this coming governor's race, just how vitriolic it will be and the aftermath of that, and how it may really get Republicans mad at one another by March?
It's a risk. It's a very real risk, and many people have voiced that to me. I think it is unfortunate that it has become a little bit more personal much earlier than I would have anticipated. I really thought at this point we'd be talking about principles more than personalities, and I'm disappointed about that. But at the same time, each candidate has to run their own race the way they feel best suited to do so. I think we as Texas Republicans are perhaps losing a little bit in this bargain because it has gotten so personal so quickly. Let's talk about the big principles, because there are a lot of them out there. The direction of our country is a real problem right now. Many people that I've talked to over the summer and even the months before feel absolutely betrayed by their government, not just in Washington, in Austin and locally as well. And that is a real phenomenon. And people who devote themselves to public service need to take that seriously.
Thanks very much for your time.
Yes, sir.
I appreciate your being here today. Lawmakers and critics have